Good afternoon and welcome to the Flint Community Webinar on coronavirus. Believe it or not, we are now in week 92, for this webinar, and we're excited about being able to come to you today and welcome you. This webinar is brought to you by the Healthy Flint Research Coordinating Center, the Flint Center for Health Equity Solutions, and the Michigan Prevention Research Center. Just as a quick reminder, we started this webinar a few weeks ago to bring to you a local context to a global pandemic. And I've been fortunate, along with a couple of others, to be your webinar for most of these 92 weeks. And as a co-director of the Healthy Flint Research Coordinating Center, we certainly hope that this information has been valuable to you. We could not have done this alone, however. We have had a wonderful array of partners who've joined us for these weeks to make sure that we're bringing you credible and accurate and right now information, as one of our partners likes to say, real time. And so we again appreciate all of these partners. If you're listening to us by phone or you're joining us and you can't see the screen, I'm just going to tell you some of the partners that are here. And please know that you can put questions in the Q&A, or you can give us a call at 810-835-2130, and we'll be happy to answer your questions. Our partners serve as panelists every week to respond to questions to you. Panelists like the Genesee Health System, Genesee Health Plan, the Greater Flint Health Coalition, our partners from Michigan State University, University of Michigan Flint, Hamilton Community Health Network, and so many partners that have joined us this week and many weeks to help make sure we answer questions from you, even from the city of Flint, Genesee County Health Department. And today we'd like to appreciate a couple of our partners as we go through this session today. We have some topics that are going to we want to make sure that you are abreast of. You know, many of you have asked us these questions over again, and we're going to try to make sure we emphasize some of these questions for you today. We're going to talk about the Omicron variant and COVID vaccine boosters. We're going to talk a little bit about today, what do you do if you think you have COVID? Then we will hear an update from the Genesee County Health Department, the city of Flint, as well as talk about some things through our policy brief and give you an update on some data for the city of Flint, Genesee County. Today, we'd like to appreciate three of our partners that have joined us over these weeks. We have Genesee Intermediate School District. We also have had representation from the state of Michigan for many, many weeks. Gary Jones was here sharing with us, and we'll have a new representative hopefully in the new year, as Gary has moved to another position within the government. And then the Mass Transit Authority, who early on came on to help us understand what we needed to do as it related to public transportation in our community. And we'll hear more from them in the following weeks. But today, I'd just like to ask Tricia Hill, who is with the Genesee Intermediate School District, just to join me just for a quick moment as we say thank you to the Genesee Intermediate School District for sharing information with us over the last few weeks. Tricia, thank you so much for joining us today, and just give us a greeting today, and if you have a highlight from the Genesee Intermediate School District.
Absolutely. Well, I want to thank you too. 92 weeks is quite a journey, and I know it's provided a lot of information to our community, and we're just happy to be able to give perspectives from the schools. We have children in our schools every day, and it gets confusing. What are the rules? What are the expectations? How are my kids staying healthy while at school? So we're just happy to be able to provide any information needed and answer questions. So thank you for the opportunity.
Thank you so much, Tricia. Just want to remind all of our listeners that the Genesee Intermediate School District is available, but each school district does make their own decisions around some of their policies. And so if you need information, they may direct you to your local school district in order to get that information, but they are here to help make sure that our children are safe and getting the education that they need. Thank you so much, Tricia. And so now, a feature. Every week we bring to you a panel of experts that are going to help us understand some of these issues that we are addressing. So I'm going to ask our panelists, Dr. Susan Wolford, Dr. Deborah Verholden, Dr. EJ, we call her Dr. EJ, Dr. Jennifer Edwards Johnson, and then we have Dr. Pam Hackard is also here with us today. We've got some questions for you. And then let's start. We're going to start talking about this Omicron variant. I was given to understand that this is This variant is about 70 times more contagious. So I just need you all to help us, this panel, please help us just to understand a little bit more about the Omicron variant. How is it different from the Delta variant and the original virus? We'll start with you, Dr. Hackard, and then we'll just kind of bounce around in the conversation.
Sure, we can. Well, we want to remember.
Okay, Dr. Hackard, we lost you just that quick. I know we were having some sound problems earlier. So while you're working on that, Dr. Deborah, take it away. Dr. Deborah, you're wonderful on mute.
There we go. Dang, and I was about to say, I really wanted to say what Dr. Hackard was going to say. So I'm not going to steal her thunder because she really does do a fair amount of research. Oh, and here comes Dr. Edwards Johnson too. Here's what I want to say. And I'm gonna leave it to the MDs to answer is it 70 times more infectious and all of that. I feel like a big issue that we have faced throughout this entire pandemic is we have put an emphasis oftentimes on the wrong things. So here's what I would offer you. It doesn't matter if the dominant strain is alpha, beta, gamma, delta, epsilon, Omicron, Omega, whatever. Here's what we know. The vaccine is effective at preventing people from getting really sick, getting hospitalized and dying. And we're learning how long, how effective, and all of that, right? We continue to learn that. 2, none of the variants have been able to penetrate a mask. Not even one of them. Not near one of them can overcome wearing a mask and washing your hands and minding your distance and avoiding large crowds.
Wearing a mask that covers your nose.
Yes, and a mask that covers your nose. Now, what it can do is you wearing it like a girdle, it can absolutely go past the mask, like above it, but it can't go through it. Right? So the whole point is, if you look at, let's take the variant off the table, and then we will answer I'll leave it for the doctors to answer specific questions about these variants. But if you look at community spread in your community, you can see the rates, and you can see the rates starting to increase. You know, we give that nice graphic every week in the health equity brief, so you can see the rate of change week to week. You can see that the rate of change is going in the wrong direction. It's increasing. And you can even see when it starts to increase faster than it did in the weeks prior or in the month prior. That's what's really relevant for people to understand what's happening in my community. The why, the how, it's this particular variant. My concern is that the overemphasis on the variant is giving people a false sense of security. I've had a lot of people say, oh, well, they say Omicron is just like a cold and it has much milder symptoms. Well, the big study that was based on came out of South Africa. It was 40 some odd people. And that is what they found in that very small study. It did produce milder symptoms, and it also seemed to be more contagious. But it's a new variant. We're still learning. All that would have to happen is some major mutation happen to this variant that spreads a lot more easy, where it also makes people more sick. And that little temporary false sense of security that you had would very quickly be overtaken by a sense of dread. So
one of the things you're making clear to us is there's still a lot of information that we don't know. Studies are being done, and that's a critical piece you mentioned in there, sample size. You know, some of the sample sizes are very, very small. And we know even with the vaccine, they did some really large sample sizes to look at the effectiveness of the vaccine. And so it's really important for us to get as much understanding as we can. So that's why your questions are so important. I want to encourage you again, put them in the queue. Let's see, Dr. Wolford, while you and Dr. EJ, can you talk to us about the variant? Because people are asking questions about this. So we do want to, and I agree 100% with you, Dr. Deb, let's pay attention to what really works. But we have these questions. So can you help answer some of those questions about the variants?
Sure. So to the question, thank you so much, Yvonne. So the question of how is this variant different from the others, from Delta? So it has many, many more mutations. And even that, we're not sure exactly many more. And as as Dr. Deborah says, it doesn't really matter specifically, but let us say it's around 32 mutations on the spike protein. Some have said they've found up to 40 something, but let's say it's 32 compared to Delta, which only had 18. The point of that number is that with all of those changes to the spike protein, the question comes up, will our vaccines work against it? And the other question comes up as to, how well our body will fight it off, right? And can it now hide from us? And what does it do differently to our bodies? So 2 things. The vaccines are still shown to have effectiveness against Omicron where it comes to severe illness and death, right? So it is better to get it than not. Yes, it's not as great as it was against the very first form of this coronavirus of COVID-19, but it still protects us. I think Dr. Fauci estimates around 70% against severe illness, hospitalization, and death. So worth getting the vaccine. The second thing is, how does it affect our body differently because of these changes in the virus? And studies are suggesting that it's able to make copies of itself much faster than the previous ones. So remember, we talked about how viruses like to make copies of themselves. And by doing that, that's how they destroy the cells that they're in. So in our airways, in our nose and in our airways, it is particularly good at making copies of itself. And that's where that 70% more comes from. It's 70% faster at making copies of itself in our airways and in our nose. So really, that mask, put it on. We really want to avoid it getting into our nose and our airway, because once it's there, it can make really copies really quickly, and therefore add to how contagious it is.
Thank you. Now, Dr. EJ, you're working in the hospital, so you see, so kind of help us out with really what's going on based on these changes that are happening with this virus.
I think we should be a little worried, if I'm honest, right? We are still in the middle of a Delta wave, and we have an Omicron wave that is actively building, and our hospitals are very, 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 very full, right? And I think it means we need to be thoughtful about our gathering. I think it means we need to be wearing masks. It is hard to be seen in an ER anywhere across the state right now because they're full. So that doesn't mean even for COVID, that means that you cut your hand open, you get in a car accident, it's full. So, I mean, I think Dr. Deb made a really great point. We have to focus on what we control and focus on what we know. And that means masking, getting vaccinated, decreasing our risk. But I agree, like the data that we have is really early, and the data we have suggests that Omicron variant is more infectious due to everything Dr. Wolfer just said. There's some early data suggesting that the symptoms might be more mild, but and certainly more mild in people who are vaccinated. But I think that still means we have to do our due diligence, because we have colleagues, friends, family members who might be immunocompromised, who may not develop mild symptoms, and who may end up in an ER or a hospital system that is overburdened.
Thank you, Dr. Jennifer, because you brought up something else too. Between, life is still happening, so people are having other events that happen. Heart attacks are still happening, strokes are still happening. And if our ERs are full because we didn't do something that may have helped prevent us going to the ER, that's a challenge for us. It really gives us something to think about. Dr. Hackard, I see you made it back.
Yes, thank you. I'm on Michelle's line now. And also they're rebuilding me a computer right now. So I wanted to just build on what Dr. Edwards had said, because I think it's really a very important message. And I had just heard this statistic this morning that 60% of America cannot get the booster shot right now, which would be the children under 5, and then also people who have had their second shot within 6 months. And that's why we really need to keep the mask on at this point because we don't have the protection. Couple other interesting things though is that, well, I'll let the conversation go, but I just wanted to add on to that part of it because it's 60%, that's a lot of people.
So we talked about the mask, and Dr. Reynolds, I don't want to leave you out because I know you're chomping at the bit there to say something. So Dr. Reynolds, you have a story that I shouldn't say a story, but you have phrases that you say to us all the time about this situation. So give it to us this afternoon.
Vaccination is the foundation for the prevention of infection. So you start with that. And then you add those other layers of protection, or what we also call mitigation, onto that. And, we talk about hand washing, we talk about wearing a mask, physical distancing, but sometimes we don't emphasize enough using our brains. Now, if we know that there's a highly contagious virus out there, we limit the size of our gatherings. And I come back to our favorite topic: birthdays, funerals, weddings, holiday celebrations. You really have to think through how many people you'll have in the house and how you'll use these mitigating measures. Who's vaccinated, who's not vaccinated, who's immunocompromised or immunosuppressed. And really, it's a responsibility. If we're going to be responsible adults, we got to think this through and make a plan. A very close friend of mine is having, her son is getting married New Year's Eve. I had to call and cancel. Just looking at this new outbreak, it was it was prudent, based on what I know now, that I should not be in a large gathering with people I do not know. So that's it. And let's look at the numbers. 11:30, November 30th through the 6th, the Omicron virus in testing was 0.4%. 2 weeks later, it was 2.9%. So that means it's increased by almost 7 times. In New York, New Jersey, the testing region of New York, New Jersey, Puerto Rico, and the US Virgin Islands, the Omicron virus is now in 13.1%. So what we're dealing with is not a joke. And the more people who get infected, even though we say now it may be milder, that means the more people who are still at risk of being hospitalized. So that doesn't mean it's safer on a community level, and we don't know which individual doesn't have a problem.
Thank
and
you,
I'll stop like that because I see my colleague's hand up.
Yeah, Dr. Hackard got her hand, and Dr. Deborah's ready to go. Okay, Dr. Hackard, then you, Dr. Deborah, just jump in.
I do. I don't know if this was said, and I apologize, and stop me if someone already said this, but I think a really nice way to look at the vaccination associated with Omicron is to remove one vaccine from how protected you are. So we all know how protected you were with one vaccine against the original. With Omicron, it's as though you have had none. If you have one vaccine, it's as though you've not been vaccinated. If you have 2 vaccines, it's as though you had one with the original virus. So with Omicron, you really need that 3rd booster to be protected almost to the extent, you'll be protected almost to the extent with the earlier viruses when you had 2 doses. But that's a good way to look at how much more this evades our vaccines. They still work, they're still really important, but we do need to look at that 3rd booster now as a 3rd dose. Much like the hepatitis shots that we got, hepatitis B as children, you get it one and then another one like a month apart or so, and then one 6 months apart. And that's how you protect it. That's how you boost your immune system against hepatitis B. And that's how we boost our immune system against Delta virus, against the Omicron virus now. But just imagine one less.
Yeah, so Dr. Hackard, that's great information, but I would tell you, we're gonna have to come back to that and tease that out a little bit more to make sure we get some clarity on that. because the question is asked, and I want to go to you, Dr. Deborah, that if I've already gotten these 2 vaccines and I'm supposed to be fully vaccinated, then how come I can still get the virus? So I want to ask Dr. Deborah, because Dr. Susan, you mentioned this about wearing the mask, and you said, I think you said, Dr. Deborah, the virus doesn't get through the mask. So maybe we're not wearing it right. We actually, one of our listeners, and I want to give them credit for this, because they sent us an email just as we asked them to do, and said, we don't talk enough about this anymore. Tell us how to wear the mask properly.
So I got my mask right here. And I'll say, because now masks have become a part of our regular life. And I just want to know, after we had SARS and some other things that hit other parts of the world really bad, masking is just like now a part of people's lives, especially during certain seasons and certain times of the year. So, and I talked about this with Dr. EJ and my good buddy, Isaiah Oliver. So I'm encouraging people, get masks of different colors if you'd like. I've got black, I've got white, I've got blue, I've got gray, I've got pink. These are going to be with us for a while, folks. Include it in your life. What a great Christmas gift to give to people. I ordered these off of Amazon, a big bag of KN95 masks in different colors. So how do you put it on? So you grab it by the strings on the side and you put them on. Notice I'm not touching, I'm avoiding touching the front of the mask on purpose. Now, see, I got that girdle thing going on. See, it's not above my nose. So you pull it up and then you make sure that the metal part is on the top so you can pinch it and get a good fit over your nose. And people complain if you have glasses, it fogs up your glasses. And it does sometimes. I find when I pinch mine well, it doesn't fog up my glasses and I'm fine. Imagine if you've been out all day and you've just been out. Remember, this is a virus spread through droplets. You might have droplets on the front of your mask. If the mask has done its job, it stopped things from coming in. So if you touch the mask like this, whatever's on the mask is now on your hands. So you don't take your mask off by grabbing the front of it. You take your mask off again by going to the strings on the side and you pull it down the same way that you put it on. And I really want to let people know these are not masks that are made to be worn multiple times over multiple days. Actually, if you look on the back of many of the masks, it will tell you how long it was designed to be worn for. But I can tell you, at the end of the day, without fail, your disposable mask needs to go in the trash. Do not keep these masks, adults or children. They were not meant to be worn for multiple days on end. So you put it on from the strap and you take it off the same way. And then you throw it in the trash.
Thank you, Dr. Deborah. And you said something that I learned. I had a dear friend that was in a nursing facility. And when we came in, they asked us to take the mask off that we had outside and throw it away and get a new one. And then when we went out, you were encouraged to take that one off and throw it away and get a new one. Yeah. So sometimes even going in and out of certain spaces, you shouldn't take the same mask in, or have the same mask on when you go out for that very reason.
Well, that was a really great example, because in those types of in a care facility with people who are facing terminal illness or severe illness, you want to do everything that you can to protect them. So yeah, it makes good sense that if you were the person operating that facility, you don't know, somebody might have had that mask on for 3 days and you don't want them coming in, with the mask that's not actually going to function the way it's supposed to function. The other thing that I want to say, and it's a little bit of a personal thing, is that my daughter had to go to the emergency room this week. And I am not a physician. I am a PhD in public health. And I tell people that all the time. I'm not that type of doctor, but I hang out with a lot of those type of doctors. Dr. Hackard has made this point about stressing that during times of pandemic, it overwhelms our healthcare system. My daughter sat in the emergency room for 7.5 hours and described the most traumatizing experience We went to bring her food and she refused to stay. She demanded to leave and she got in the car and she said, I'm not going back. It's filled with patients who have COVID and other illnesses. It's not all COVID, but there are a lot of COVID patients. Many ERs cannot allow guests because they simply don't have the room and they don't want people who are not sick potentially getting sick in the waiting room. They're having to take back the people who are literally at risk for a very bad health outcome or death at that moment. So people who are very ill, who in times of non-crisis would get back earlier, are sitting in the wait room with a major illness for hours. And when I say hours, I don't know how long, because my daughter, who had a major illness, sat for 7.5 hours and was only seen once by a triage nurse who took her vitals. I talked to my colleague at Michigan Medicine who said, this is what a healthcare system looks like right before it collapses. Us doing everything that we can to keep people out of the emergency department and out of the hospital is critical. Because imagine if you take your loved one to the emergency room for a cardiac event, or because they've been in a car crash, or because they think they might be having a stroke, and they're sitting in the emergency wait room getting sicker because literally the emergency department has exceeded capacity. They have no other doctor to see them that's available, no other nurse to see them that's available, no other bed to put them in. That is where we are right now. If it gets any worse, our healthcare system and our ability to treat people will collapse. We've got to do everything that we can to keep people out of the ED, out of the hospital. We've got 8,000 people dying a week from COVID. What that means is on December 1st, there were 32,000 people who were COVID negative, who will be dead by New Year's, and they don't even know it. They were fine on December 1st, and they will be dead by New Year's. Like, I'm just begging people to please take this serious and do your part. And your part is getting vaccinated. It's putting that mask on. It's not doing the large events. It's washing your hands and honoring these basic protocols that we have in place. We owe it to each other.
Thank you, Dr.
Can I just?
Yes, go ahead.
Just
Dr.
have to
Warford.
jump in because what Dr. Deborah said is so correct. On December 1st, I remember December 1st very well. Actually, remember November 31st very, very well. The last day in November, I was on a prayer line with one of my close friends, and they were well. They were well. They were older, they're very old. They've done everything they could do to protect themselves. They've taken the vaccine, they've done everything they could do, but they were older. They passed away 2 nights ago from COVID. They were well the beginning of December. They are gone today. We all have to do our part. We all have to do our part. It might be mild in one person. It might be asymptomatic in one person, but it spreads. And not everybody has the same health conditions as everyone else. So I just want to echo, you were so right, Dr. Deborah. You could be fine, and 2 weeks later, you can be gone.
And I would also echo the correctness of the other piece of that is I lost a friend 2 weeks ago, well, it was November 30th, 2 weeks ago as well, who had a cardiac, she was young, she was, in her early 60s. She had a cardiac condition that you don't normally have any issue with. It was, AFib, you can treat that, you can do things with it. And she died because she waited in the emergency room and it was overpacked with COVID. So people we know and people we love are dying either of COVID or they're dying of this, unexpected things of waiting from the emergency room, you don't usually think that someone can't wait a little while with AFib and Flint.
Thank you. Dr. Reynolds.
Yes, as a pediatrician, I get exasperated because many times it's said in the media that COVID is not as bad in children. And thank God that may be factually correct. However, when you look at the loss of primary caretakers, I'm talking about because parents who have custody, grandparents who have custody, foster care, several months ago, it was 140,000 children lost their primary caregiver. Now it's estimated to be 176,000. When the study was first done, 65% of the children who lost parents were in communities of color. And I'm talking about African American, Latinx, and Native American, Alaskan Native. So the impact is so disparate. And if you narrow it down to certain states, that impact is even greater. So whenever we talk about COVID, we are talking about protecting our community. And COVID doesn't recognize, you're my friend, I care about you, or I hate your guts. COVID just infects. And we have to remember, we are protecting our community, and it's not just about me.
Thank you, Dr. Reynolds, and thank you all for such passionate sharing in this roundtable. There are more questions that we didn't get to today, so please join us if you can. Just as a FYI, we're going to have a webinar next Friday. We will have a webinar New Year's Eve Friday, but because we want to make sure that we continue to give information to you. So please join us for those future events, and we'll talk a little bit more about this. I do want to say, as we said, put in a local context to this global situation. I just want to remind us all, everybody is making decisions. We are hoping to provide for you information that will allow you to think through and make a good decision. You have to think about what's best for you and your family. And if in fact, as Dr. Reynolds mentioned and others have mentioned, there are individuals who cannot get the vaccine, and we understand that. There are medical reasons why people cannot get the vaccine. So then it is a responsibility for those of us, and maybe there's not a medical reason you're choosing not to get the vaccine. But the important thing is to consider others as well. And the masking, as Dr. Deborah has showed us, the information has been shared to us about how we can protect ourselves and protect others by doing those what we call universal protocols. Everybody can do it. Everybody can wash their hands. We can all stay at home if we're sick. We can all make sure that we cover our mouths when we're coughing. These are things that we can do. Stay in our family units, even in our family units. We do want to exercise some caution during these next 2 weeks for holidays. So thank you, panel, for that wonderful information that you shared with us. Please, again, they're going to be joining us, some of them in the next couple of weeks. Stay tuned because there's more information coming. We want to hear from you. All of us have different perspectives. We want to hear from you as well. Today, we want to just move a little bit further in our session today. Again, let me say thank you to this amazing panel. But we do want to talk about what's going on from the health department perspective with the upcoming holiday weekends, what's going to be happening with respect to our testing sites and our COVID vaccine events. Sherelle.
Good afternoon. So I think that these webinars have really been reaching people within the community because since last week, we've seen an increase in vaccinations over 5,000 in just 1 week throughout Genesee County. And so we're doing well. Next slide, please. We are still encouraging vaccines. And last week, we did not have full guidance on booster doses for our 16 and 17-year-olds, but now 16 and 17-year-olds are eligible for a booster dose. So any individual who received the COVID Pfizer vaccine are eligible, and they must be 6 months after their primary series. Next slide. which brings us to our vaccination clinics. Usually I will have a lot posted for the upcoming week, but we will not be administering vaccinations at the health department, well, through the health department, starting next week. And we will be back January 4th with a normal schedule. I would like to say that even though we won't have vaccinations available for the next 2 weeks, our testing sites, Word of Life, Bethel United Methodist Church, as well as Macedonia Baptist Church, will be available Monday through Wednesday in the upcoming week. And they also offer the Pfizer vaccine. So children and adults can still get a vaccine throughout next week at one of those 3 sites. And you can get tested for COVID at one of those 3 sites, as well as our local Walgreens, Rite Aid, and Hamilton Community Health Network. And lastly, you don't have to call and make an appointment. We ask that you just come in to any location when we're operating. And we still want to make sure that we are serving our homebound residents. So if you know anyone who can't make it to a clinic, we ask that you give us a call at 810-344-4800 so that we can serve them after the new year.
Thank you, Sherelle. But can we go back to the testing site slide for just a quick moment? I just want to make sure we emphasize to our listeners today the dates and times of the testing sites, because at the testing sites, they also do COVID vax. And so one of the things we want our listeners to be aware of is that they will be open Monday, Tuesday, and Wednesday. However, Christmas Eve and Christmas Day and the Sunday following, they are going to be closed. So we're going to encourage you, if you want to get testing, and if you want to get vaccinated before, they will be open through Wednesday. So we encourage you to get those testings before Wednesday of this week and Wednesday of the following week, because those sites will not be open on the eves to nor the holiday and following. I just want to make sure we got that correct. That's the messages I got. Is that correct, Sherelle?
That is absolutely correct.
Okay, so go ahead.
I would just like to say, with the holidays coming up, it would be very smart to get a test before gathering with family. That's all.
Yeah. So again, we would encourage you, expect a little bit of a wait. It's good if you make your appointments, because most of them will be taking appointments. Until then, they take them every day. They're taking appointments. So Word of Life on Athens Road, Bethel United Methodist in Macedonia. Word of Life Tuesday and Wednesday next week. Bethel Tuesday and Wednesday of next week. Macedonia on Monday only of next week. So please keep this in mind, share this with your friends, and thank you all so much, because you do take this information and share with others. Trust me, they let us know that you share again, so we appreciate that. Thank you again so much, Sherelle. We appreciate the update from the health department.
Thank you.
Dr. Deborah, we're back to you and the what's happening with this health equity brief and all of the good information that you will share with us, Dr. Deborah.
Wonderful. Okay, thanks, Yvonne. As usual, we want to give you the numbers, and I'm going to ask people again, take this with a grain of salt, but I like to give what I call a weather report. So if we compare the numbers from this week to last week, the cases are down, but here's my caveat. We had Thanksgiving week, that week here that ended November 28th, right? Because Thanksgiving was November 27th. We had a lot less testing that was happening that week. So I would expect when we look at the week that ends December 5th, you might see fewer cases, but that's an artifact of we maybe had the cases, but we didn't identify them. So we'll keep tracking that number of probable cases and that number of lag cases. But as of right now, it looks like the case count went down. But folks, remember, we are still in the surge. And now we know we've got this, more infectious, more contagious, easier to spread strain of the virus in, communities all over the world. So folks just continue to stay safe. We've also been tracking what percentage of the cases that we have are in the hospitals. And we talked a lot about that earlier. And again, just underscoring for people, we've got to keep people out of the hospital. We've got to keep them out of the emergency department for COVID. Why? Because it's preventable. Dr. Hackard talked about her friend. Her friend could not help her heart condition. And when that heart condition flares up, she has no choice but to go to the emergency department. She can't just walk into the cardiac unit and admit herself. She has to go in through the emergency department, but it's clogged because we got so many COVID patients in there and people with other conditions that we aren't able to treat body. So the percentage of people in the hospital in Genesee County who are fully vaccinated, it's still hovering. It's below 30%, which is good news, right? It's like the vaccine is then helping to keep people from having to be hospitalized for COVID. It's not perfect, but it is much better. Clearly, almost 75% of the hospitalized cases are people who are partially vaccinated or unvaccinated, or their unknown vaccination status. So the vaccine is still doing a pretty good job at preventing people from going in the hospital. So we just got to stick with that. We have some other good resources that are available to people in community. We've got some toolkits that have been developed by the schools. Genesee County has lifted the school mask mandate, and that is mostly because now the vaccine is widely available for children age 5 and older, which is our school age population. And we all know our wonderful health officer, Dr. Hackard, ventured out on the skinny branches and was the first health officer in the state of Michigan to issue a mandatory mask mandate for school children. And it's an issue that divides us. Some parents got really up in arms, but let's be really clear. Dr. Hackard says it's the best thing to do. Our, public health community here, our pediatricians here said it's the right thing to do. The state has said that, the CDC and the American Academy of Pediatrics agrees that universal masking should continue in schools to keep not just the children, but all of the people in the building, all the adults and the staff and the others that are there. So do check out these new toolkits that are available. And again, if you get the health equity brief, there's a link in there for how you can access that information. And remember, vaccination remains the best way to prevent severe COVID infection and hospitalization. And the best way to prevent infection in the first place is to put all of those layers in place. Wear your mask, get your vaccine, get your booster, wash your hands, and be mindful about your gatherings, especially indoor gatherings. Keep them small, well-ventilated places, and stay masked. Mute.
I was listening so intently, I forgot. Thank you so much, Dr. Deb. Just on that note, I know this is again holiday season, so I want to ask you, as you talked about these protections. So what are your recommendations here? Wearing a mask, but when we do these gatherings, should we open up our windows, kind of give them additional ventilation? Or is that another layer of protection that we can add to our toolkit?
Yeah, remember, this spreads through droplets. So the staler the air, if you just circulate in the same old stale air, that's no good. What we want is called good air exchange. You want some of that good fresh air from outdoors to replace some of that stale air that's indoors. And the best way to do that is to have a way for the air that's in to go out and a way for the air that's out to come in. It's air exchange. So you'd like to have the air moving. So what we did, and I had for Thanksgiving, very small. I had my cousin and her partner came over to visit, and they're, fully vaccinated, recent negative COVID test. And we just turned on the ceiling fans. We cracked the windows And then I turned on the, you know, I had the heat in my house circulating. So we've got air moving in the house, and then we've got air moving and air from the outdoors coming in and air from the indoors going out. And I just wanted to get real slick with it and got a little cross ventilation. So, you know, you ever been in the car and you will roll the window down in the front, or somebody will roll the window down in the back and your ears will hurt, and you realize you got to have a little bit down in the front, a little bit down in the back, and then you get like an air exchange. We sort of figured that out in my house, how we could get a little bit of fresh air exchange. So yeah, if people can do that, that's the best. And then also activate those outdoor spaces if possible. I've got a nice, great sun porch. We opened up the door, we opened up all the windows, we had the fan out there. I even put a little TV out there, which we normally don't have, in case people wanted to watch the game. Why? Because people are yelling and blah, blah, blah with the game. So I said, I'd rather y'all be doing that out there than in my living room, right? And so we did that as well, because the temperatures are unseasonably warm right now. And so outdoors is also always best.
I'm glad you said that, because I talked to another colleague of ours earlier this week, and they had said because of the Omicron variant and all of the fears that they weren't going to do anything, not have any family over. And they talked about how isolated they began to feel just even having that conversation. So they did decide that they were going to open up the garage, and so they could get that outdoor and just make sure that people could fellowship together, still have some family time, but outside. Now, if it does get a little cold, you may have to limit the amount of time. But one of the important things you said, as much as possible, to still try to have some socialization, but do it in a mindful way. So that outdoors is an option for us.
Yeah, it looks like Dr. Hackard was going to say something. I know she's probably, you know, she's got recommendations too as the doctor.
The really like wonderful thing I had to say, I forgot it. But you don't actually need too much open. You just need like an inch or so. And so you don't have to freeze yourself. Oh, I know what I was going to say. So they're talking about like the flow of air. A couple points on that. So I'm not sure about the ceiling fan, but I do know, I looked it up because someone had tried to use that in an office. I said, that doesn't seem right, a good idea. And so I looked it up, and yeah, there's studies on it. So don't blow a fan, like don't blow a table fan right down your table. That actually spreads it more. You want it to circulate through, because it's not only respiratory droplets, but it's also airborne particles. And so they will float up and out. So you don't want to necessarily, like I think the ceiling fan is a good idea, but not a direct fan. And then also, if people are traveling in cars, there is also some really interesting things. You want to have a air wall built. And so you crack the driver's window and the passenger rear window, and that builds a wall right between the two. So you are pretty darn safe if you do that and you're sitting next to the person in the front seat, but you have that diagonal wall there. And then the other safe spot would be if you're in the driver's seat, and then you're in the back seat behind the driver. Those would be the safest spots by doing that. So think about when you're deciding what to ventilate, think about the fact that you're kind of creating an airflow wall and trying to keep people on each side. Particularly if you have some unvaccinated ones, I would put them in a separate room and keep that room separate, really. If I mean, we can't all do it, but I did tell my family members, and I actually talked to Dr. Reynolds yesterday about this, but I said, unless you've been boosted, you cannot come. You need to be boosted. I actually just said you need to be boosted. And then they said, are we not welcome if we're not boosted? And actually, so last night she said she got 2 appointments at CVS this Sunday. So I didn't think that was going to happen, but it did.
Well, Dr. Hackard, you woke up Dr. Reynolds again. He had to come on, turn his camera off. Dr. Reynolds.
Yeah, it was a little crazy. So
just so you all know, I've told my 2 adult children for Thanksgiving when they weren't vaccinated, don't come. And I've told them for Christmas and New Year's, since you're not fully vaccinated or vaccinated at all, do not come. And it sounds rough, but I've got my members of this household to take care of. And there are other people on a limited number who also need that protection. So thank you, Dr. Hackard.
Okay,
But
now
I
I
think
know
1 minute
we
to tell a personal story.
okay,
This is,
and so Mary Catherine, hang
I'm
on, we didn't forget you. Come on,
sorry.
come on, Dr. Hackard, because I have another question that come up. Dr. Hackard.
I was sorry. I was just going to say that yesterday, when this whole conversation was going on, it was a group conversation, and I was having a separate chat with my sister-in-law, who's a nurse. She accidentally posted in the group chat what she was sending just to me about this, and nobody responded at all. So I put in, I said, clearly, this was meant to be an individual one, but I had been talking about my sister who was afraid to get her the booster shot because there was severe reaction to the second one. And I said, I normally don't say things like this. I think it's the first time ever, but I told my sister, because I was trying to get into work, and I said, look, I'm a doctor. Like, I don't know why you wouldn't want to believe me when you believe me for all these other things. So just believe me and get your shot. And she did. And so that's when the other sister-in-law, who didn't want to get the booster, had responded individually and said that was the same thing as holding me back as what your sister was experiencing. And I gave her a couple hints, like take a little ibuprofen before you get the vaccine, get it in your dominant arm and move your arm around a lot, like to the point where you look silly, move your arm so much. And if you have to, take a Benadryl afterwards. That can help reduce the inflammation that could be causing some of the fever.
Okay, so now that we're back on vaccines, I got a quick question for you. So a person has been vaccinated, had both the vaccinations, so they're fully vaccinated, got COVID. When should they get, I'm losing my question. So when should they get a vaccination again, or the booster, after a recent infection?
Generally about 4 weeks.
Okay.
And that's gone down a bit. They used to be 90 days, and now with these variants, they're going to four weeks.
And can you just give us a little insight as to why the wait? Because I did hear somebody say a few weeks ago, that they could go ahead and get it right away as soon as
you can get it. You can get it like as soon as you're not infectious to others, so 10 days after the infection by being diagnosed. But we kind of know that you are protected for a little bit. It's just that a little bit is shortening. It used to be 90 days and now it's down to like 4 weeks. So that's kind of why. And then you would stretch out the potential booster working for you, because like that infection almost works as a booster of its own.
Okay.
So it's not as good as it, but that's why.
Okay. Thank you. And I see your hand, Dr. Reynolds, and then we're going to get to Mary Catherine.
Yes, Dr. Hackard has a photographic memory, but we didn't discuss the J&J vaccine. If you got the J&J vaccine first, you need to get your booster 2 months afterwards. So 2 months after your J&J vaccine, get the booster, and ideally that booster should be Pfizer or Moderna.
Thank you, Doc, because I was going to ask you that.
So they are saying don't use the Johnson & Johnson now for the booster.
For the booster.
Do one of the other two.
Right.
And I think, before people like say, well, why did we even use Johnson & Johnson? I think you do have to keep it in context that it was quite effective against the original COVID. It's just these variants have made it so that it's not. So you do want to get a booster as soon as possible with Moderna or Pfizer.
Thank you, Dr. Hackard, and please join us because there's next week, because there's more on this. And I do want to say a quick thank you to our providers, because they have been checking MICR as an eyewitness on Friday at the event. When the health providers checked the MICR, which is a Michigan Care Registry, they identified a child or a young person who had not fully completed that length of time for their next vaccine. They were 1 day away from being approved to get the vaccine, and they would not give that vaccine. So it's important that that information is in MICR. It's important that our health professionals are following the protocols to make sure that they're administering these vaccines as it is supposed to be done. So thank you to the Genesee Community Health Center for being so diligent. Mary Catherine, I know you're just ready there to tell us all about the health policy updates. So Please take it away. You got your all sandwiched between there, but you'll handle it.
That's okay. So I want to kind of go back to what was being said earlier about our hospital systems and our issues with capacity, right? Because these are some of the biggest issues facing Michigan, and especially as we continue through this wave of Delta, and then the Omicron wave emerges, right? So two things I want to talk about, right, is one House bill that was just introduced this week. It's about like a $1.1 billion spending bill to expand access to an administration of monoclonal antibody treatment to patients. And what it would do would establish early treatment sites in every emergency preparedness region, which there are 8 in Michigan. And then not only would money be going to establish these treatment centers, it would also prioritize monoclonal treatment for high-risk individuals, so people with chronic conditions, cancers, and different other immunocompromised individuals. So another about 300 million would actually be allocated to recruit and retain health employees in Michigan, right? Because we continue to face these staffing shortages, which we've been talking about. And further still, this was a really big piece of legislation. It would actually provide a lot of funding for the Michigan Department of Health and Human Services to purchase and then kind of stockpile COVID contact tracing and testing resources for distribution to schools, so that we can continue to keep our eyes on and students and staff at our facilities a priority. So the second piece of legislation actually was presented to Governor Whitmer to sign yesterday. And this is solely specific to addressing the staffing shortages that we know are going on. And so what this bill would do is, only in the presence of a health crisis would licensed medical providers who hold like active and current licenses in other states would actually be able to practice in hospitals and provide care in Michigan, even though they don't hold a license from the state of Michigan itself. And so this would be a really great option to help get more people into hospitals and get care to patients in need.
Thank you so much, Mary Catherine. Appreciate that update. And so continue to look forward to these opportunities as we hear more about them as they come to our community. From the city of Flint, we have with us today, Lottie Ferguson, Chief Resiliency Officer. Lottie, please share with us the updates.
Yes, hello everybody. Can you hear me okay?
Oh, it's Kiana. Okay.
It is indeed. Lottie is still out, so I'll be Lottie Ferguson today.
Okay.
All right, just a couple updates from the city. Beginning with our vaccination efforts this week, we've been really excited to host 3 of the 4 vaccination clinics we're planning to host this week. And we've been able to vaccinate or get boosters to more than 70 individuals, including more than 50 City of Flint employees. So we're really excited about that. The final clinic is this afternoon from 2 to 7 at the mini station at Martin Luther King and Bishop. And Mayor Neely and Chief Green are coming over this afternoon to get their booster shots. So we're excited about that.
All right.
And just one other update, the EPA's regional administrator, Deborah Shore, she's going to be in Flint today over at Kettering University at the Innovation Center, which is located at 1300 Bluff Street. From 2 to 3:30, she'll be there for a meet and greet. Looking forward to meeting members of the community. The EPA just asks if you are planning to attend the event to give Diane Russell a call at 989-395-3493, just so that they can make sure to adhere to room capacity for COVID protocol.
Thank you so much, Kiana. Right on time. Appreciate knowing what's happening in the city. We want to encourage our community health workers and our social workers, please complete your documentation for your contact hours or your continuing education units. If you have questions, you feel free to contact Mary Catherine Crawford at F457@msu.edu. We want to tell you again, always like us on Facebook. We are eager to have you join us. Like us on Facebook so we can be prepared to share more information with you. Join us or subscribe to our Healthy Flint YouTube channel, Healthy Flint, or email us at any time at info@hfrcc.org. You can always feel free to call us at 810-835-2130. Just want to remind you, if you need an appointment for your boosters through the health department, just give them a call and they will schedule an appointment for you. We will be here next week. I know it's going to be Christmas Eve, but yes, we'll be here to share information for you for the next or the 93rd session of the Flint Community Webinar on Coronavirus. Thank you so much for joining us today, and we'll look forward to seeing you next week.